If you experience any type of leg swelling, this is a very early warning sign of venous insufficiency or venous disease. You may first notice swelling by the end of the day in your ankles. That then progresses to swelling that you see early on in the day that worsens by the end of the day. This swelling then oftentimes leads to weeping of a serous fluid. You may experience a white to yellow fluid coming from the lower extremities. You may also see blistering occurring. That then is the first early warning sign that you may be having an ulceration to develop. You may notice visible varicose veins. You may also notice the skin discoloration, itching, burning, heaviness, tiredness, fatigue in your lower extremities are all warning signs of venous disease. Leg cramping can be also a warning sign of venous insufficiency, so be sure if you're having those restless legs of the night, cramping during the day, give us a call. Patients oftentimes present with redness, warmth in their lower extremity. They may also notice some variations in color. This is usually progressive. You may notice just a slight change that continues to grow starting from the ankle moving up into the calf area. As soon as a patient notices these signs and symptoms, they should give us a call to schedule an appointment. The sooner that we can get you in and start your treatment, we can optimize your treatment plan and get you back to doing your normal activities much quicker. So venous disease is progressive, just like any other disease process. If left untreated, will only get worse. So one of those things that we try to prevent is ulcerations. So our goal is that if you first see those warning signs of venous disease, is that you get those treated. We never want this to develop into an ulceration, so early treatment is key. Patients oftentimes think that there is no answer for their wounds, that they're there and that they're just going to have to live with them. That is not the case. We can absolutely help you get your life back. Do not wait. Give us a call. The experts at the Vein Company can provide you comprehensive care from the early beginning signs of venous disease all the way up to ulceration. So our goal is to not only treat your ulcer, but also to treat the underlying cause. Here at the Vein Company, we offer many different treatment options, from compression therapy to advanced modalities to make your treatment optimal. Your first wound care visit, you'll come in, we'll essentially assess that wound. You may have a test performed called an ABI. This lets us see if we have a concern for any arterial insufficiency or if we are looking at a true venous ulceration, which 80% on the lower extremities are venous in nature. After that, we will review signs and symptoms that you're experiencing, and we will go over some treatment modalities and work with you to find what fits your lifestyle the best, as well as what we think will ultimately optimize your wound care healing. Our goal is for your wound to be healed within 14 weeks. Ultimately, the longer that you've had that wound, the longer it may take us to heal. However, our goal is 14 weeks. We want to see progression every week that you come in to see us, and we take weekly pictures as well as measurements to determine how your wound is progressing. I love treating wounds. This is my passion. One of the best parts about my job is getting to see the lives that I change. I have healed wounds that have been called unhealable. I have watched patients that were not ambulatory start walking again. I have saved extremities from amputation, and that is why I love my job. If you're living with lower leg swelling and you're hesitant to come and see us, we make you feel very comfortable. You are in charge of your treatment plan. We will give you the options, but ultimately the decision is yours, and we will do whatever we can to provide you the greatest care. Venous disease is progressive if left untreated. You do not have to live with these symptoms. We can help you here at the Vein Company.